So, welcome to the second session, and we were discussing the muscles of the hand and wrist complex, as well as we were discussing some structures related to the wrist and hand, which are associated with the tendons and muscles. उसमें से carpal tunnel हमने discuss किया. Again, carpal tunnel is associated with the tendons, flexor tendon. We have discussed in detail. एनाटॉमिकल स्नैपर्स हमने डिस्कस कर दिया कि इसकी कौन कौन से टेंडन जो है इसकी मीडियल एंड लेटरल बाउंड्रीज बनाते हैं. देन हमने एक फ्लेक्सर शीथ के बारे में बात की कि उसकी दैट इज द ब्लाइंड टनल एंड वन एंड इज क्लोज अदर इज द ओपन. देन उसके बाद हमने सैनुअल फ्लेक्सर की शीथ की बात की and then we started from the long flexor tendon, which are the two tendons, the superficialis and the profundus tendon. ये हमने डिस्कस कर गया. Then we discussed the small muscles of the hand, which the part of the intrinsic muscle of the hand. इस लेक्चर में हम extrinsic muscle include नहीं कर रहे हैं. Extrinsic muscles are those muscles which have the origin in outside the wrist and hand complex, are proximal to the wrist and hand complex, and they insert in the wrist and hand complex, and their action is in the wrist or hand. So, so common flexor of the wrist and common extensor of the wrist जो attach होते हैं on the epicondyle of that humerus. तो उसमें से जो lateral epicondyle जो है वहाँ पे जो एक्सटेंसर टेंडन है वो अब द कॉमन ओरिजिन ऑफ द एक्सटेंसर टेंडन ऑफ द रिस्ट वो है, जबकि मीडियल एपिकोंडाइल ऑफ द एल्बो जो है वहां पे जो फ्लेक्सर है कॉमन फ्लेक्सर ऑफ द रिस्ट ये उनकी कॉमन टेंडन है. इस तरह कुछ मसल जो है दे आर फ्रॉम द रेडियस एंड अनला की शेप से वहां से ओरिजिनेट करके फिर आगे जाके ये रिस्ट एंड हैंड कम्प्लेक्स में इंसर्ट हो के फिर वहां पे एक्शन करते हैं. सो इंट्रिंसिक मसल जरूरी नहीं है कि तमाम की तमाम जो है ये एपिकोंडाइल से ही ओरिजिन करते हो. सम ऑफ दीज मसल्स दे आर ओरिजिनेटिंग फ्रॉम द शेफ्ट ऑफ द रेडियस एंड अनला. One of them is the palmaris longus, and other muscles they all are the common the flexor tendon and the tendons they are originating from that medial epicondyle and lateral epicondyle. The smaller muscles of the hand, which are also known as the intrinsic muscle of the hand, and these are those muscles whose origin and insertion are both inside the hand or wrist complex. To remember that all of them they are four in number. Either they are the lumbrical, the interosseous, or they are the thumb muscle or the little finger muscle. In some books, the little finger muscles they are considered as three, but they are four in number, and both are right, three and four. Lumbricals they are four in number. The palmar interosseous they are four in number. The dorsal interosseous they are again four in number. And then the short muscle of the thumb known as the thenar muscles, and the short muscle of the pinky they are known as the hypothenar muscles. So then we discussed the palmar interosseous, then we discussed the dorsal interosseous. And remember कि palmar interosseous जो है ये adduction करते हैं, and dorsal interosseous जो है ये abduction करते हैं. Then we discussed the lumbricals, palmaris brevis, and then the short muscles of the thumb, they are the adductor pollicis brevis, flexor pollicis brevis, and the last one, opponens pollicis. इस सेशन में हम शॉर्ट मसल ऑफ द लिटिल फिंगर डिस्कस करेंगे और साथ साथ हम मीडियन और अननब की बात करेंगे. दैट विल बी द एंड ऑफ द सेशन. शॉर्ट मसल ऑफ द लिटिल फिंगर या पिंकी जो है ये छोटे मसल्स होते हैं और उसमें जो मसल इंक्लूडेड होती है दे आर द abductor digiti minimi, the flexor digiti minimi brevis, and the opponent digiti minimi. So here three are mentioned, but in some literature and some textbook they are also four in number, which together form the hypothenar eminence. The opponent's digiti minimi muscle is only capable of rotating the fifth metacarpal bone to a slight degree, while this muscle also helps the flexor digiti minimi and flexing the carpal metacarpal joint of the little finger. So the pulling of this fifth metacarpal bone is made forward by just by the cupping of the palm by this muscles. So this muscle has a very important role in the cupping of the hand and the gripping of the that hand. These are the hypothenar muscles, these are the thenar muscles, and these are the hypothenar muscles, also known as the hypothenar eminence. And all these muscles they are related to the pinky. So one of them is the abductor digiti minimi, and their origin is from that physical farm bone, and the insertion is on the ulnar side of base of the fifth proximal phalanx. You can see here, this is the ulnar side at the middle side of the proximal phalanx. This is the pinky. This is the proximal phalanx. This is the ulnar radial side. This is the ulnar side. So this is actually the flexor digiti minimi. ये मसल जो है ये उसका है दिनार मसल का है which is the flexor pollicis brevis. Ulnar nerve is supplying this short muscle. Many of the short muscles जो है they are supplying by the this ulnar nerve. And इसकी जो main function जो है this is the metacarpal phalangeal abduction जो है of the fifth digit जो है. The next is the opponent digiti minimi. It is a small muscle and that originate from the hook of the hamate. We know that the hamate is the most medial and as well as the distal bone of the that wrist. This is the fourth member of the distal row on the medial side. So this digit minimi that attached to the hamate to the hook, and that hook is actually present on the hamate just for the attachment to this opponent digiti minimi. Similarly, this muscle also originates from this transverse carpal ligament at TCA, which is blended with the flexor retinaculum, and its insertion is on the entire fifth metacarpal bone. This is the metacarpal bone. This is the first metacarpal bone जहाँ पे ये अपने pollicis muscle होता है. This is second, third, fourth, and this is the fifth one. Ulnar supplying is that, and the flexion rotation of the fifth digit is actually the function of the opponent digiti minimi. The next is the flexor digiti minimi. Again, it originates from the that hamate bone, but not from the that hook of the hamate, and it originates also from the that TCL. इससे पहले जो हमने डिस्कस किया था that was adductor digiti minimi, right one this is the flexor digiti minimi. Again this is attached to the ulnar side of the ये दो मसल्स आपको नजर आ रहे हैं. तो उनमें से जो मीडियल वन है ये एक्चुअली ये फ्लेक्सर मसल है और इसमें जो लेटरल मीडियल वन है यानी इससे ये साइड वाला मसल एक्चुअली ये एब्डक्टर रिजिडी मिनिमी है. ये दोनों मसल जो है यहाँ पर मिडिल साइड ऑफ द या अल्नर साइड ऑफ द प्रॉक्सिमल फेलिंक्स पे ये यानी डिजिट की जो प्रॉक्सिमल फेलिंक्स है इसकी मिडिल साइड पे या अल्नर साइड पे ये इंसर्ट होते हैं. जबकि इसके अटैचमेंट ओरिजिन जो है ये ट्रांसवर्स कार्पल लिगामेंट से एज वेल एज जो है ये हेमेट बोन से ये हेमेट बोन से आती है इसकी ओरिजिन जो है. जबकि जो दूसरा सबसे मिडिल मोस्ट वन जो एब्डक्टर है और यहाँ पे उससे थोड़ा सा प्रॉक्सिमल अटैचमेंट. Again, the nerve is the ulnar nerve, while its main function is the metacarpophalangeal flexion of the fifth digit. इस जगह पे ये actually इसकी flexion करती हैं and this flexor digiti minimi. अगर हम इसकी बात कर ले नर्व की तो दो नर्व दे आर वेरी इंपॉर्टेंट ऑन द इंटीरियर साइड एज इन द आर्म regarding the entrapment, regarding the biomechanics, regarding their pathologies. One of them is the median nerve and the other is the ulnar nerve. The median nerve, as we have discussed, that it enters the palm by passing beneath the flexor retinaculum and through the carpal tunnel. This is the one branch which just coming above the flexor retinaculum. And whenever there is entrapment of the median nerve inside the retinaculum, So this branch is spare and this branch is not involved in that pathological condition. It immediately divides into the lateral and medial branches. The ulnar nerve, again, that is young canal में से ये निकलता है, and this ulnar nerve entered the palm interior to the flexor retinaculum alongside the lateral border of the palm bone. As it crosses the retinaculum, it divides into superficial and deep branches. These are the two branches. The superficial and the deep branch, terminal branch, the nerve may be compressed at this side, giving rise to the clinical sign and symptom, and known as the Guillain-Canal syndrome. So this is the insertion of the long extensor tendon. We have discussed the flexor tendon, and now where the extensor tendon attached. So the four tendons of the extensor digitorum emerged from under the extensor retinaculum. This extensor retinaculum is actually the combination of that flexor retinaculum. This is the flexor retinaculum and इसकी exactly continue होता है at the extensor retinaculum. And then they spread out to form and over the dorsum of the hand. Strong oblique fibrous band connect the tendons to the little ring and middle finger proximal to the head of the metacarpal bones. We have discussed in detail in the previous lectures that what we mean by this oblique band, oblique sagittal band. These are the specific bands which keep this extensor tendon on its own place. So we are going to skip that and not going to discuss them. We have already done with that. The tendon to the index finger is joined and its middle side by the tendon of the extensor indicis. The tendon of the little finger is joined at its middle side by the two tendons of the extensor digiti minimi. That was the end of today's session. Just read out this slide. It's nothing so difficult. We have discussed the intrinsic muscle only, so there will be no such inclusion of the extrinsic muscle and only the intrinsic muscle there will be included. Thank you so much to all of you.